document from NHS Scotland?
Well, a caveat first and foremost, I've not seen the original minutes from the meeting, so we ought to be careful what we extrapolate from it. And health is a devolved matter, so these discussions don't necessarily have UK-wide implications. My understanding was that this is a section of the meeting where attendees were encouraged to consider what a transformed NHS could look like. So it's an open discussion, not a set of concrete proposals to debate. But what I think we can say is this. So first of all, I think asking the question, what can be done with the financial constraints that we have is completely sensible. We do need to think hard about how we can make the NHS financially sustainable in the long run. And I think we ought to think about revenue raising as well as taxation increases. The issue is that I don't think creating a two-tier system has been reported today is the way to go. First of all, you might ask who is wealthy, according to the definition as reported. But I think more importantly, my view is that charging, for instance, for elective treatment, so people that are on waiting lists, will actually just encourage people to delay, to defer their care, thereby exacerbating their conditions and actually just increasing costs overall, in this case to the user of the service, but also to the system more broadly. That being said, I do think that some of the other suggestions that were leaked today are worth some further thought. So one thing is that there's mention of the cost of the NHS picking up the costs for life-enhancing, not life-saving treatments. And this is an area where I think something more can be done to actually make savings. So this is things like surgery for snoring, where actually they say that this is something that NHS shouldn't commission, and therefore you can make savings as a result. The other thing that I would mention that I think it again is worth some further thought is that the discussion seems to have touched upon the topic of prescription charging. This is an area where actually in England we already have a degree of co-payment in the system, and Policy Exchange are of the view that this is something the government ought to review as well. So we as it stands today, we've got one of the most generous schemes in Europe. 2/3 of the population qualify for free prescriptions by hitting one of a series of exemption criteria, by being over a certain age, being under 18, for instance. And about 90% of all prescriptions are dispensed in the community free of charge. That's costing us nearly £10 billion a year. 9.69 billion was the total last year. Frankly, we think it's time that you could look at the recommendations again from the 2014 Barker Commission, which is something commissioned by the King's Fund think tank, which looked at removing some exemptions to that scheme and replacing them with a cap. So fundamentally, you protect those on the lowest incomes and where they've got long-term conditions, and so they're going to be needing multiple prescriptions. But what you can do is you can look to reduce that £9.35 unit item charge that people have at the moment, but actually a greater number of people are paying, and our calculations were that you could save $2 to $3 billion per year for the Exchequer through doing that. So I think there are things that we can look at in some of the suggestions raised today, but obviously with lots of caution because we need to see the detail behind them.
Other suggestions reportedly in the minutes including setting a target to discharge patients within 23 hours. This is a real problem in England and elsewhere where patients are not discharged soon enough, even though they're ready to go home, and therefore you've got ambulances queuing outside hospitals because there are no beds.
This touches upon a fundamental problem. In hospitals, you speak to anybody working in a hospital at the moment in the emergency department, and they'll tell you the fundamental problem why they can't get people through A&E and out the back door eventually is because of a lack of capacity in the community. And so one of the things actually that was welcome from the Chancellor's statement last Thursday was this commitment to uplift the Better Care Fund. That's something else that Policy Exchange called for over the summer, and that is something that will help to create more places for people to be discharged from hospital. But let's be frank, the situation is difficult at the moment, and that would be understating it.
See, the Prime Minister, Rishi Sunak, is registered with a private GP practice, according to The Guardian tonight. He's charged £250 for a half-hour consultation and is promised he will be seen on the day. Is this the future, perhaps, for people who are more well-off than the rest of us?
Well, I think a lot of people, frankly, are sort of voting with their feet, and more people actually are deciding to take that option. But I think that principle fundamentally of having a healthcare system free at the point of use to meet those with the greatest need, who fundamentally are the ones often have less access to care, is a very important principle and one that we ought to uphold. So I think it's good that we have choice in the system. We fundamentally support that. If people do want to pay, on top of what they're already paying in general taxation and through national insurance for a service like that, and who am I to tell them that they shouldn't do that? And also, if you have healthcare professionals who want to deliver that service, that's something that I would support. But fundamentally, we need to ensure that we have a system in place that caters to those that need care the most.
Thank you, Sean. Sean Phillips, who is a research fellow, to give him his full title, in health and social care at Policy Exchange, the charity.